by the way, this is tonsils, how they look like, more or less. Yeah, so you can see that this is epithelium, what covers this. This is lymphoid tissue inside. And what we have, these depressions, like grooves, it is called crypts of the tonsil. Yeah? So in these crypts, meeting of the antigens with the antibody occur, yes, so therefore, and we have reaction like immunity reaction, immune reaction. Okay, so now, so we described the palate. What should we do now? We should say about the teeth, I guess, yeah? Teeth. Okay, so let me check again. Alimentary system, yeah? Mouth, lips, cheeks, hard and soft palate, teeth. Okay. Okay. So teeth. How many teeth do we have?
30.
Depends. Have you ever counted your teeth or not? Do you know how many teeth you have?
28.
Somebody counted. Somebody knows.
2, 1, 2, 3, 1, 2, 1, 2,
Okay,
3.
it can be 28 to 32, but full set is 32. But because our modern people
29.
don't chew so much, and it is going like from generation to generation, gradually our jaws became smaller, and sometimes we don't have place for posterior teeth, yeah, and they will never erupt, or who has it at the late age, for example, they can erupt different direction, and then we can just remove them because they can erupt and be directed to the cheeks, to the palate, and they have no use of them. And even they spoil faster. Okay, so this is, how do we call this last molars, third molar? Wisdom tooth. Okay, so doesn't mean that everybody who has it is a wisdom person, yeah, but anyway. Okay. So now let's look at this teeth. Yeah, so and we have two generation of teeth. What we have? Milky or decidual, and we have permanent. Yes. Okay. Let's look first how each tooth is, like what we can find. Yeah, it's made. So here you can see the big tooth, and it consists of like different kind of tissues. This one, yeah. We know that it has parts, yeah, which crown, okay, then root which sits in the alveoli, and neck, yeah, okay, and partly it's covered by the gum, yeah, or gingiva. Gingiva, what do we call gingiva? The mucosa which covers alveolar process or alveolar part and part of the tooth, yeah. In the healthy tooth, it covers the neck and a little bit crown also, okay. This is gingiva. And this alveoli we call alveolar bone, okay. So then, tooth itself has what? Crown is covered by the layer of enamel. The root is covered by the cementum. Yeah, cementum, it's like more like bone by structure. This is doesn't have any organic substances, just not organic. And then dentin, the bulk of the tooth. Yeah, so this is dentin. We have it in crown, we have it in root. And inside, what do we have? Dental cavity or coronal cavity, and then root canal. And root canal ends by the opening, yeah, at the tip of the apex of the root, okay. And through this opening, nerves and vessels get inside, yeah, and they will be loose connective tissue inside surrounded these vessels and nerve. And and it is called what, this tissue which is inside, it's called pulp of the tooth, yeah, pulp, pulpa. So when inflammation of this pulp happens, it is called pulpitis, yeah, and usually people experience very bad toothache. Why it's so bad? Because if it is inflamed, any tissue actually, we have edema, means it will be more fluid, yeah. So if it is somewhere superficially, this will be elevation just, yeah. And if it is here, there is no space where extend, yeah, and it will be pressure on the nerves which are inside, so therefore it's very painful, yeah, so because it's limited space here. Okay, it's just like lyric, some not related to your main thing. Okay, now what surrounds the tooth? Yeah, so I don't know how it's written here, if it is written at all. Maybe it's not correctly written, so I just look at it, and maybe it is not written at all, most likely. Let me see what do we have. Okay, the space between the root and dental alveolus is filled with alveolar periosteum. It is not periosteum, it is wrong. It is periodontium. This is called periodontal ligament actually. This is wrong how it is written. So doesn't matter. Let it be periodontium. So actually, excuse me? If you want to know the real, how they call it, yeah, dentist, and how it is accepted by the International Dentist Society, already like for 20 years, I guess. So this is called space between the periosteum, which covers the alveoli. Yeah, any bone has periosteum, yes? Between the periosteum and the cementum, we have periodontal ligament. Yeah, so what we said about this connection, fibrous joint, yeah, alveolar dental joint, or gymphosis, yeah? So here we have small, you see these fibers, they form ligaments, which dentists study very precisely. They know each one, how they are directed, each has name. So this is all together we call periodontal ligament, okay? And when we say periodontium, what is written here, we mean what? Everything. So it will be cement, whatever surrounds the tooth and fixes tooth in the alveoli. It will be cementum, it will be periodontal ligament, it will be periosteum, actually all alveolar bone, and it will be also, what is very important, gum, yeah, which should be connected very tightly to the tooth. Otherwise, if you have damage here, the microorganism can get over here. So periodontium actually it's all this, okay, what surrounds and fixes the tooth in the alveoli. So therefore, inflammation of this tissue in a bad case scenario can cause the situation when we can lose tooth, yeah, because it will be, first it starts from gingivitis, damage to this, people will have bleeding, yeah, from the gingiva, then it becomes worse, more microorganisms, microbes can get inside, then they destroy gradually the periodontal ligament, then you can see in some people this gingiva becomes lower, and then it will be atrophy of the even alveolar process, and then teeth become shaking, yeah, and then people cannot chew already, and just one issue only to remove them, or it fell out by itself, yeah. So this is called periodontitis, this disease which has like bad, it's heredity actually, yeah, if your like ancestors, so forth, yes, or how do you call the parents and all the grandparents and so on had this problem, so most likely that you will have the same, yeah. So this is heredity problem, but they can you can decrease, for example, the velocity, how it develops. Okay, so clear. So periodontium, it's not like what is written here. You can say that just the tooth is surrounded by the periodontium. And this what is written here, periodontium, it is what? Periodontal ligament only, okay? So, now we